Well, good afternoon, everyone. I'm Linda Hughes. I'm Chair of Alberta Health Services Board, and I'm happy to welcome you to our first monthly public board meeting for this fall. I hope you all had some opportunity to take some time off this summer to recharge and spend some quality time with people you care about. Rest and relaxation, after all, are needed to achieve health and wellness. That's why we encouraged all our AHS workforce to take some vacation time if they could over the summer, because as a healthcare organization, we try to practice what we preach. Having said that, AHS accomplished some very important work over the summer months, including release of the 2017-2020 AHS Health Plan and Business Plan. This document outlines how we'll help Albertans consistently see the right healthcare provider in the right place at the right time. A big part of this involves what we call enhancing care in the community. That means moving appropriate programs and services out of our busy hospitals and into community settings where Albertans can get the care they need close to home from a multidisciplinary healthcare team. You can learn more about enhancing care in the community and our other priorities by reviewing our health plan and business plan, which is now posted on the AHS website. I'm confident this plan and its action items will help AHS attain our 4 goals, which are to improve patient and family experiences, improve patient and population health outcomes, improve the experience and safety of our people, and to improve the financial health and value for money. Throughout the fall, AHS leaders and Health Advisory Council members will share and talk about the health plan and the business plan with Albertans in local communities, as well as specifically with local and provincial leaders. The board looks forward to hearing the feedback of Albertans that we gather during these engagement processes, and we'll try to respond accordingly to what we hear. Now on to today's agenda. All our committees are reporting today and recommending as well as reporting on some substantial pieces of work that we have been doing. Before we get to that, though, I'd just like to share a little piece of good news. Earlier this month, our president and CEO, Verna Yu, was named recipient of the 2017 Canadian Society for Quality Leadership Award. The honor is certainly well-deserved. Verna's leadership qualities are on display each and every day in this organization, and she's brought stability, good stewardship, and clear vision to the healthcare system. In true Verna style, she accepted the award by acknowledging the hard work and dedication displayed by all 120,000 AHS staff, physicians, and volunteers, and gave them the credit for it, of course. She said healthcare is a team sport, and that's true, but AHS and Albertans, I think in general, are very fortunate she's our quarterback. Isn't that a great line? So anyway, on behalf of the board, Verna, I'd like to say congratulations for that. Now, before I turn the mic over to Verna to say a few words, I'd like to make sure everybody has the agenda. Could someone move approval of the agenda? Thank you. All in favor? Thank you. Declaration of conflict of interest. We always have to do this. Has anyone got a conflict of interest to declare? No, hearing none, I'll move along. You've all seen the minutes from our previous meeting. Does anyone have any issues or questions about those minutes? All right. Would someone like to move approval? Glenda, all in favor? Great, thank you. With that, I will turn the mic over to Verna.
Thanks very much, Linda, for your kind words, and thank you to the board for your continued guidance and support. Good afternoon to everyone, and I hope you're enjoying the fall. Today, I'd like to highlight 2 AHS events that happened around this time of the year. That's the Foundation's Leadership Forum and the Advisory Council's Fall Forum. I had the pleasure to attend the annual Foundation's Leadership Forum just a couple of weeks ago in Calgary. It was a great time. There were more than 100 people who attended over 3 days, and we had representation from over 40 foundations, as well as AHS leaders from all 5 zones. We networked, we shared new ideas related to philanthropy, provided updates from AHS, and discussed our successes and best practices. There was absolutely a positive tone and a spirit of cooperation throughout the event. I'd like to congratulate our Foundation Relations team for organizing the forum and for all the work they do year-round in building strong relationships with the province's health foundations and trusts. Meanwhile, the Advisory Council's Fall Forum is now about a month away. It's slated for October 27th and 28th in Edmonton, and it will gather members of our 12 health advisory councils, 3 provincial advisory councils, and Wisdom Council, as well as members of the AHS board and executive leadership team. As usual, there are going to be sessions devoted to issues that relate most to our communities, including addiction, mental health, opioid response, continuing care, and Indigenous health. Like the Foundation's Leadership Forum, the Advisory Council's Fall Forum is really an outstanding opportunity to strengthen relationships, broaden our engagement, as well as share information with our key partners. Talking about engagement and key partners, I also want to update you on a new development with one of our other councils, the Alberta Clinician Council. It has been renamed the Alberta Clinician Professional Practice Council to reflect an expanded role. This council consists of frontline leaders in AHS who advises us and advances AHS organizational priorities. They also help identify, champion, and support initiatives related to collaborative care, quality, and professional practice. The Alberta Clinician Professional Practice Council will continue to complement the efforts of our Patient and Family Advisory Group, which brings a patient and family perspective to discussions on AHS policies, practices, and planning. All of our advisory councils and groups are helping AHS evolve into the high-performing patient and family-centered healthcare system we strive to be. I know that we're making progress and we're moving in the right direction because almost every day I'm made aware of a new program or initiative that really exemplifies what patient and family-centered care is all about. Recently, staff and volunteers at South Health Campus in Calgary decided they wanted to do something special to improve the hospital experience for patients with dementia. With the help and support of the Alzheimer's Society of Calgary, here's what they did. Please take a look.
So Opening Minds Through Art, it's meant to be an intergenerational program for people with dementia. So they're paired one-on-one with a volunteer. It's all about the relationship that they're building, and they're using art as a creative means to form that relationship. Week after week, we do a different art project. This is the art show that we're using to showcase all of the wonderful art that's been created from our patients.
I particularly love these colors. Like I really love the peacock blue and the purple. And then because of some of the way the lines are fragmented a little bit, to me it sort of relates a little bit, just a feeling of the whole issue about dementia, really.
Well, a lot of good stuff. It's interesting. It just proves that you can't count anybody out. Everybody's got something to give. Everybody's worth something.
I went to music at a very young age. I played guitar and sang on stage on Cape Breton Island, that's where I'm from. And I was 4.5 years old. That's my art, there's no doubt. No doubt in my mind.
This was his life, to entertain. When he saw some folks on Unit 68 down and out, worse off than him, he said, "Oh, honey, I have to see, and would you mind if I go and play guitar down the end of the hall?" So he would play guitar and try and make these folks happy. Caitlin brought that, she picked up on that. She was able to have him look forward to the art show for the past month.
Even people who have dementia, there's still a lot of creativity to tap into, right? So we're rating the patient's mood before they actually participate in the art, and then they have some feedback questions as well about how the project went, and then we reevaluate their mood at the end. And as soon as they come to the program, you just see them light up, and they're so engaged with their volunteers as well. It's really special to see.
Volunteers were so sweet. They sat down, they were patient with him. He was no longer a diagnosis, he was a person again.
But you did a beautiful job, Emma.
Did I?
Yes, you sure did. And I like the way you did all the little strokes and the
Yeah,
balanced
and
the
little
picture.
sparkles too.
Yes, yes.
The line that really stands out for me in this video comes from David's wife, Georgina, who said her husband was no longer a diagnosis, he was a person. This is the sort of holistic care we want to deliver consistently, always treating patients with dignity and respect. And Albertans, through our advisory groups and councils, are helping us do just that. We are extremely grateful for their invaluable contributions to our healthcare system. Before I hand the mic back to Linda, I just have a couple of more items I want to share with you. The first is related to the Infection Prevention and Control Annual Report that's coming to the board for approval today. AHS has made some significant progress in improving hospital-acquired infection rates since the start of provincial surveillance in 2011-12. Over the ensuing 5 years, the rate of hospital-acquired MRSA has decreased by 31%, and C. diff infection rates has fallen by 21%. As a provincial-wide system, we've made wide-scale improvements in practice, including consistent patient management, improvements in environmental cleaning, hand hygiene compliance, and appropriate antibiotic utilization. Together, these coordinated actions all contribute to a decrease in hospital-acquired infection rates, and I'd like to thank our IPC team as well as our staff physicians and volunteers for their unwavering commitment to safety. Finally, I'd like to point out that AHS officially launched our annual influenza immunization campaign earlier this week. The AHS flu website and clinic lookup tool have been updated, and you can find them at www.ahs.ca/influenza. As usual, influenza immunizations will be offered free of charge to all Albertans 6 months of age and older through AHS clinics, pharmacies, and physicians. Public clinics open on October the 23rd, and I encourage all of you and your loved ones to get immunized and protect yourself and others from influenza. Thank you for your time today and for your interest in AHS.
Thank you, Verna. Next on our agenda, we'll move to the Human Resources Committee. Marlis, you have a report?
Thank you, Madam Chair. And on behalf of Mr. Dicerni, we met as a committee on September 13th of 2017. The committee discussed measures and results related to our people strategy and other workforce performance indicators and received an update on labor relations and essential services. Management provided the committee with an overview of the implications to AHS of the recent amendment to the Employment Standards Code and Labor Relations Code under the newly enacted Fair and Family-Friendly Workplaces Act. The committee also discussed initiatives in the organization to address health and wellness, employee safety, and diversity and inclusion. There were no items that came through the committee for board approval, and that ends my short report.
Thank you very much. So moving on to quality and safety, Glenda?
Thank you very much. The Quality and Safety Committee met on September 13th, 2017. We discussed the third annual Quality and Safety Summit that will be happening here in Edmonton on October 30th and 31st of this year. We began the meeting with a patient safety moment, understanding how the organization had taken an incident and taken it again organization-wide and built safety practices that are really leading throughout the country. We received an update on continuing care and quality in that sector. We received the results of the 2017 accreditation survey, the on-site survey that was done this year. And we also received a summary of quality and safety related indicators. Additionally, we looked at the committee's terms of reference for discussion and feedback and supported forwarding some minor housekeeping changes to the governance committee for their consideration. And finally, as Dr. Yu mentioned, we received and went through the 2016-17 Infection Prevention and Control Annual Report. This is a report that we produce every year, and it reviewed the structure and it provides an overview of our outcomes achieved in partnership with our programs across the province, including accountability and monitoring, provincial surveillance, human resource capacity, physical environment and infrastructure, and public awareness and education. And the committee recommended that the board approve the report for submission to Alberta Health. And accordingly, I move that the Alberta Health Services Board approve the 2016-17 Infection Prevention and Control Annual Report for submission to Alberta Health. I so move.
Could I have a seconder? Hugh? All in favor? Carried. Thank you. Next is Audit and Risk Committee. David.
Thanks, Madam Chair. The Audit and Risk Committee met on September the 14th. Standard practice is that the Office of the Auditor General and KPMG are guests at the meetings in their role as external auditors of AHS. The committee discussed various audit matters, including the results of the OAG Primary Care Network follow-up audit, a report from the AHS Investigation Coordination Team, status of the outstanding internal and external audit recommendations, and revisions to the internal audit and enterprise risk management department plan, and the internal audit charter. Finally, the committee proposed revisions to its terms of reference, which was forwarded to the governance committee. There are no items presented at the committee to be considered for board approval this time.
Thank you. And now you could give us the Finance Committee report.
I hope people could have heard that one then, I guess. Didn't have my mic turned on. No, I think it'll be fine. I spoke loud enough, I'm sure. Finance Committee also met on September the 14th and again on September the 22nd. We considered 4 items for recommendation for approval of the board. First, the 2017-2018 first quarter investment report. As mandated by AHS investment bylaw, the committee is required to review reports prepared by management and investment managers summarizing the activities and performance of AHS investment portfolio on a quarterly basis. The Regional Health Authorities Regulation and the AHS investment bylaw describe the requirements for the board to approve or ratify by resolution AHS investment decisions. The committee was presented the June 30th, 2017 first quarter investment report and recommended that the board ratify the transactions. Accordingly, I move that the Alberta Health Services Board ratify the investment portfolio and transactions described below and as certified by signed investment compliance certificates from AHS and Philip Sager and North Investment Management. A, as at June 30th, 2017, AHS held restricted and unrestricted funds managed by Philip Sager and North Investment Management and Manulife Financial totaling $1.589 billion. B, funds were invested in short-term treasury bills, federal, provincial, and corporate fixed income bonds, pooled mortgage funds, bond funds, Canadian and global equity funds. And C, all of the funds invested during the quarter ended June 30th, 2017 were invested in accordance with the investment bylaw and investment policy as certified by signed investment compliance certificates from AHS, Philip Sager North Investment Management.
Could I have a seconder? Linda? All in favor? Passed.
Finance Committee considered the terms and conditions of an Alberta Health grant agreement regarding on-call physicians. The grant agreement exceeds the approval and signing authority level of the AHS President and CEO and therefore needs to be approved by the board. The committee recommended the board approve the grant agreement and delegate signing authority of the agreement on behalf of AHS to the President and CEO. Accordingly, I move that the Alberta Health Services Board A, approve the Alberta Health grant agreement for the operation and management of the on-call programs and provision of on-call services by physicians for the term April 1, 2017 to March 31, 2018, and B, delegate authority to execute the grant agreement on behalf of the Alberta Health Services to the President and Chief Executive Officer.
Seconder? Brenda? All in favor? Carried.
The Finance Committee reviewed the terms and conditions of the CanWest Master Services Agreement between CanWest Corporate Air Charters Ltd. and AHS with respect to the provision of aviation ambulance services. Commitment value of the agreement exceeds the approval and signing authority of the AHS President and CEO under policy number 1100, delegation of authority and establishment of controls for commitments. Accordingly, the committee recommended that the board approve such agreement and delegate signing authority to the President and CEO. Accordingly, I move that the Alberta Health Services Board A approve the CanWest Master Services Agreement between CanWest Corporate Air Charters Ltd. and Alberta Health Services on the terms and conditions reviewed by the Finance Committee and the Board, and B, delegate authority to execute such agreement on behalf of the Alberta Health Services to the President and Chief Executive Officer in accordance with policy number 1100, delegation of authority and establishment of controls for commitments.
Thank you. Seconder? Marlis? Everyone in favor? Okay, that's carried.
The committee have reviewed the terms and conditions of the master license support and services agreement between Epic Systems Corporation and AHS. The commitment value of the agreement exceeds the approval and signing authority of the AHS President and CEO under policy 1100, delegation of authority and establishment of controls for commitments. Accordingly, the committee recommended that the board approve such agreement and delegate signing on behalf of AHS to the President and CEO. Accordingly, I move that the Alberta Health Services Board A approve the master license, support, and services agreement between Epic Systems Corporation and Alberta Health Services based on the terms and conditions reviewed by the Finance Committee and the Board, and B, delegate authority to execute such agreement on behalf of the Alberta Health Services to the President and Chief Executive Officer in accordance with policy 1100, delegation of authority and establishment of controls for commitments.
Thank you. Seconder? Hugh? All in favor? It's carried. Thank you, David. Community Engagement Committee, Brenda.
Thank you, Linda. The Community Engagement Committee met on September 20th, 2017. The committee received the Community Engagement and Foundation Relations Report for discussion. The committee also discussed the Foundation Leadership Forum that occurred September 15th and 16th in Calgary and the positive feedback that was received around this event. The committee discussed the engagement plan for sharing in the 2017 to 2020 health plan and business plan and discussed the annual report submitted by the Health Advisory Councils and the Provincial Advisory Councils. The committee reviewed the committee's terms of reference and suggested some minor revisions to be reviewed by the Governance Committee. The committee also considered 2 items for recommendation for approval of the board. The first is the Q2 Advisory Council member appointments and renewals. Under the amended bylaw for Alberta Health Services establishing health advisory councils, the board is required to approve appointments of members to health advisory councils. Under the amended bylaw for the Addiction and Mental Health Provincial Advisory Council and the amended bylaw for the Cancer Provincial Advisory Council, the board is required to approve appointments of members to provincial advisory councils. We're very grateful for the commitment of our volunteers across the province. We value their work and appreciate their commitment to healthcare in the province. Given the number of appointments, the names will not be read at this meeting, but will be incorporated into the minutes of the meeting and posted publicly. Accordingly, I move that the Alberta Health Services Board approve the Advisory Council member appointments and renewals as reviewed by the committee and the Alberta Health Services Board.
Seconder? Brenda? All in favor? Carried.
And the second is a Q2 appointment of trustees to health foundations. The committee received the quarterly request for appointment of trustees to established foundations and trusts. The request to appoint trustees to established foundations is in compliance with the Regional Health Authorities Act, the Regional Health Authorities Foundations Regulation, and the bylaws of the foundations. Again, we are very grateful for the commitment of our foundation volunteers across the province. We value their work and appreciate their commitment to healthcare in the province. Given the number of appointments I gained, the names will not be read in the meeting, but will be incorporated into the minutes of the meeting and posted publicly. Accordingly, I move that the Alberta Health Services Board approve the trustee appointments and reappointments to the health foundations effective September 28, 2017, as reviewed by the committee and the Alberta Health Services Board.
Seconder? Marlis? All in favor? Carried. And finally, Hugh, Governance Committee.
Thank you, Madam Chair. The Governance Committee met on September 20th of 2017. Among other things, we discussed the AHS Board Skills and Competencies Matrix, how it can be streamlined. That work will be ongoing. The committee also received the Ethics and Compliance 2017-18 Q1 report for discussion, and then met with the Ethics and Compliance Officer. The Governance Committee did spend some time reviewing the terms of reference of various other committees. We reviewed the proposed revisions to the terms of reference for the Governance Committee, the board chair, board members. In addition, the committee also reviewed proposed revisions to the terms of reference for the Audit and Risk Committee, the Finance Committee, the Quality and Safety Committee, and the Community Engagement Committee. The committee recommended that the board approve all of the amended terms of reference. Accordingly, I move that the Alberta Health Services Board, 1, approve the revised terms of reference for the board chair, board members, Governance Committee, Audit and Risk Committee, Finance Committee, Quality and Safety Committee, and Community Engagement Committee. And 2, that we direct that the revised terms of reference referred to above be posted on the AHS public website.
You don't want to read out the terms of reference?
I could read them all for you if you like.
If we had an hour or 4. Sorry. Seconder? Brenda? All in favor? Thank you. And with that, I think we're adjourned. Thank you very much.